You for joining us today for today's webinar to quickly empower you with up-to-date clinical information and to assist you with result interpretation. Educational webinar examining the interpretation of marijuana results from Aegis Sciences will help us learn to discuss unexpected positive marijuana results and their potential causes. Some of these takeaways will include scenarios that may explain unexpected marijuana results, understand the period of detection of marijuana, correction of common misconceptions regarding definitive marijuana testing, and where to seek out additional clinical support. This webinar is being presented live by a member of the Aegis clinical team, Dr. Belemjian. Those who missed the live presentation or would like to hear it again may find a recording of this presentation on the Aegis website at aegislabs.com, or please call 1-800-533-7052 if you need assistance accessing the recording. Is the most commonly used or misused drug and is used by 84% of current illicit drug users. A national survey found that 1 in 10 individuals aged 12 years or older have used marijuana in the past month. Cannabis is the drug with the highest prevalence in cases involving driving under the influence of drugs and the source of more positive results in workplace testing than any other drug of abuse. On many providers' minds when interpreting drug testing results is, what did my patient actually take? In some form or fashion, this question is one of the most frequently asked of myself and my colleagues. Interpretation differs according to whether the test is presumptive or definitive, and we will primarily focus on definitive testing today. The information provided today is intended to assist providers with deciphering positive THC or marijuana results from Aegis, which have undergone definitive testing by gas chromatography mass spectrometry prior to reporting. Time for marijuana in urine depends heavily on the body composition of the patient and the frequency of use. Daily use of marijuana is expected to be detectable in urine for a period of up to 10 days, while light use, such as one joint, may be only detectable for up to 3 days. A study demonstrated that 73% of 37 chronic marijuana users had THC concentrations below a cutoff of 15 nanograms per milliliter within 2 weeks of last ingestion. Patients with a large amount of adipose tissue may store marijuana and excrete metabolites for a longer period of time, especially after abnormally heavy use over a chronic period. And in such rare cases, marijuana has been reported with a period of detection of up to 30 days, with the longest period published as 95 days. Such a period of detection is definitely the exception and not the rule. Marijuana positives in oral fluid are generally due to a depot effect after smoking, which limits interpretation to recent use. Passive inhalation of marijuana is unlikely to cause a positive result in oral fluid at typical laboratory thresholds, except in circumstances of heavy smoke exposure, long duration of exposure, lack of ventilation, and if exposure occurs on the same day as sample collection. Ingestion of dronabinol or marinol is unlikely to cause a positive test result for THC in oral fluid at a 2 nanogram per milliliter threshold, which is used at Aegis. Oral ingestion of THC produces lower and later peak blood concentrations and effects than smoked THC, and only 6 to 20% of an orally administered dose reaches systemic circulation. So using oral fluid as a specimen type may be beneficial when assessing a patient who is claiming to have ingested marinol to explain their positive marijuana result in urine. Assay or point of care testing has the highest risk of false positives among all testing methods. Medications and over-the-counter products have chemical structures similar enough to THC to trigger a presumptive positive result that would not confirm via gas chromatography mass spectrometry on an Aegis test. Some of these include acetyl salicylic acid, baby wash, ibuprofen, pantoprazole, and more. People using marijuana often attempt to tamper urine samples to produce negative results. Visine eye drops to urine samples has been shown to cause false negative results for THC. Chemical analysis of visine eye drops has shown that the ingredients can directly decrease the concentration of 9-carboxy-THC in urine with no effects on the antibodies in the immunoassay. These ingredients do not chemically alter 9-carboxy-THC, which is still detectable by gas chromatography mass spectrometry. Cannabis contains nearly 500 cannabinoid compounds, and the most widely studied being THC and CBD. THC is responsible for the characteristic high of marijuana, while CBD has not been shown to have the same cognitive effects. CBD has been studied as a treatment for multiple disease states and health conditions, including bipolar mania, Huntington's disease, inflammation, insomnia, multiple sclerosis, nausea, social anxiety disorder, schizophrenia, and seizures. Prescription cannabidiol, or Epidiolex, was developed to contain negligible amounts of THC and is very unlikely to cause a positive marijuana result. The legal limit for the amount of THC allowed in CBD products is variable, ranging from 0.3% to 5%, depending on state-specific regulations. Importantly, the manufacturing and purification processes for CBD products are not regulated by the Food and Drug Administration, leaving little opportunity for mandated CBD to THC ratios to be enforced. CBD itself will not be detected as THC on a urine drug test. It is possible for CBD products to contain THC, given that both are extracted from the same plant. Product descriptions, medical marijuana, high CBD, low THC, those are often used interchangeably, and no standard definition exists for these individual terms. Because THC content varies so heavily among unregulated hemp and cannabidiol products, the ability of these products to cause a positive marijuana result will depend on the amount of THC present in the product, the amount and frequency of ingestion, and individual patient pharmacokinetics. It is possible for the use of CBD product to result in a THC positive urine drug test. It's vital that healthcare providers use caution when recommending or reviewing CBD products for patients due to the little regulation and inaccurate labeling of quantities within these products. Inclusive of all states' regulations and possible causes of positive marijuana results, Aegis has combined the marijuana and marinol compliance calls on the urine lab report to read as marijuana/marinol. Comment mentioning CBD and hemp-containing products. So the comment reads, test result may be due to ingestion of dronabinol, marijuana, or in rare cases, use of CBD or hemp-containing products. Before we wrap up, I'd like to tell you on how to get in touch with us for additional clinical support. The individuals listed here on your screen are my colleagues, the clinical pharmacists of Aegis Sciences. We are ready and willing to take your calls and emails regarding today's content and any other questions you may have about the result interpretation. And lastly, if you would like to see references about the studies mentioned today in today's webinar, please visit this website listed on your screen here, and you can also see the downloadable version of this webinar. Thank you for listening.